For that one was a local disaster, so I think if there was a
parameter that we
something,
could comfortably do.
yeah. But it would have to be, I mean, it's gotta be local dollars to local things.
It's just so sad.
Oh, it's terrible.
They're
In
not
fact,
even
it's-
showing you all of the horrificness. because
Oh,
I
no,
don't think
and
we
they're
can
still
say-
trying to, All right, Barbara, hit the gavel for you.
Director Leach,
I'm here.
Director Morales,
Present.
thank you.
Okay, do we have any public comments?
No, we have no one in the audience and we received nothing via email and no one else is on Zoom.
Awesome. Move right to our discussion items then. We got 3 of them here. Start with A, transportation.
Okay, well, most of these are gonna be me tonight, so just updating since these were strategic initiatives we've had on our plan that we've been working on. So I've had several meetings and I am waiting a proposal from Laz Transportation Systems. And the backstory for this group is we reached out to Camarillo Health District because they offer transportation to their community. Primarily for their senior services and daycare, much like the Foundation for Senior Care. And I was asking her, you know, how their program was going, and they've been running it themselves. And she told me straightforward, they're trying to get out of it.
Yeah.
Because transportation is expensive and the insurance and the drivers and the staff. And so she introduced me to this group, Laz Transportation Systems. Now, this is what they do. They started originally as a parking company. They owned half the parking places in San Diego and a bunch of other places. And they're now national. They do a lot of transportation systems. One of the examples is if you've been to Palomar Hospital, the shuttles that run around Palomar, those are all Laz. Okay. And part of the reason that this came forward was that I've had a conversation with Perla, who's the executive director at the Foundation for Senior Care. And she let me know that they are looking to realign some of their programming to fit better with what they can financially pull. And they are looking to potentially eliminate their transportation, which is a problem already in this community. And if transportation for seniors goes away, we're going to have a big concern. So Perla had mentioned to me that the Foundation for Senior Care was interested in potentially gifting the vans to the district if we could offer transportation. I made the same face Barbara's making right now, which is yuck. I like the idea that we could provide transportation support for people to get to our diabetes program or to our wellness center programs, to make sure people could access lots of things, but financially it doesn't work out. Judith and I went through some various numbers of if we were going to bring transportation in-house, and it's just not financially feasible at all.
If I may comment, years ago when I was working at Tri-City, they had a small transportation program going, and it was supposed to be kept on the down low because of the cost and everybody knowing it. And of course, the need was so great. And it became a real problem, and they ended up not doing it after a while because of that, the risk involved, transportation, the insurance, the cars, the traffic, you can't control the traffic. And it would just be a nightmare unless you made some kind of a contract with the payors,
Right,
who
which
work with the doctors in this area, which we could not do because we cannot control that.
and I will tell you that the foundation has already tried to go down that track with very little success.
No, and they don't want to let you know that they've got this pot of money for the
Right,
transportation.
which they don't, right.
Yeah.
So that conversation with the Foundation for Senior Care came to me. And then our strategic initiative of of looking at a transportation program. Looking at those together made it very clear that we, the district, cannot have our own transportation program. We cannot financially support it, let alone managing this staffing, getting the appropriate software, having a coordinator, all of that.
Insurance on that.
The insurance, right. So that's what led me to talk to Kara at the Camarillo Health District. She indicated that they were looking to offload it to a third party who does just transportation. So I reached out to this group, Laz. I've met with them a couple of times. They have all the appropriate credentials, all the appropriate training, all of the insurances. And right now they're putting together a proposal for us that would demonstrate if we took 3 vans from the Foundation for Senior Care and then leased those vans to Laz, they would create it would go into their fleet, and that would allow them to expand their fleet and offer services out here. Now we would contract with them like a third party, right? So the vans would look like the health district. The drivers would go through all of the safety training that this transportation company requires and is required to have. They would have health district shirts. So it would look like a health district program, but we would bear none of the risk or liability. But we would be able to potentially offer a service. So one of the things I'm asking from them is obviously cost of a program. We still have to figure out a lot of details, obviously, like, would this be a fixed route where we create hubs? Could there be on demand, which is what the foundation's transportation looks like, right? Somebody calls up and says, I have a doctor's appointment tomorrow. I live here. Can you get me there? Something of that nature. So I'm still having that conversation with this partner of could they do this? All of their programming is pretty much handled through mainly an app. So like most public transportation, you would be able to go onto the app, see where the rides are, pay for the ride, all of that. They also have a phone option. So for those folks who don't have smartphones who need to call in, they could actually call into a call center that plugs them into the big transportation database. So they have all the technology, they have all the training, they have the vehicles, and they have the staff. And the fact that they already work in North County, let alone San Diego, means that they're in this market. So they're not going to have to create a program from scratch. So I'm waiting for that proposal to bring forward. Bill, I know I briefly mentioned this to you, so I wanted to let you know that I pursued it. As soon as I get that proposal, I was going to bring it forward to the board. So I just wanted to kind of update you on what that transportation is and see if you guys have questions or something that we need to add into that proposal, knowing that this is very lean on details, obviously.
This is for general transportation, right?
It would be for anyone in the district, any age. There'd have to be some provisions. Obviously, we're not going to transport 6-year-olds.
Right.
But the idea is, how could we get folks around just the district initially? I know that there's going to be questions about how do we get folks to their doctor's appointment in La Jolla or to Murrieta. The foundation is still potentially keeping in mind their volunteer program, using volunteer cars. That's on them. In talking with Laz, they said that could be something. Let's say we do this for a year as a pilot. There could be something in the future where there's an option for creating a once, twice a week, one vehicle goes to Murrieta, one vehicle goes to La Jolla, something like that. I said that would have to be obviously second phase once we figure out how this would work. But yes, we'd have to offer it for all ages. Just doing it for seniors doesn't make sense in this town. It's not financially viable with just seniors. If we open it up to the community at large, we could do this. I did have a secondary conversation because we've had community level transportation conversations with the folks over at Palomar College, the high schools. Both the high schools have early college entrance and certificate programs in the health field. So nursing programs, EMT programs. The challenge is, for example, Bontensall High School, they had to hire a bus to get their students over to the college and then to the college back. So I've met with the folks over at Palomar. I've met with the 2 high school districts and Vallecitos district. They're all in, and we have some soft promises that they would potentially financially support such a transportation program. So once we get this proposal, there is also the opportunity that we could have partners to help underwrite it. And of course, I can't imagine where this program would be free. We would have to charge some sort of rider fee, or else it just is not likely to be financially viable to the district.
Yeah.
So that's,
This is why the cabs in Fallbrook in the past 23 years went away.
right.
It was just the overhead, because you couldn't contain
Yeah,
that.
you can't have a one-man operation.
Mhm.
There's just, the cost is too big. So you have to go with a larger entity that can bury and consume those costs under larger umbrellas.
We have to start working on that transport.
Yeah, let's get the transporter. I'm game with you, Barbara. Beam me up,
Transporter, huh?
right?
Well,
This is
I just say,
all-
thank you, Rachel, for putting in, all that effort to get that information. You know, I do believe that transportation's a big part of what what we could potentially do in the future, but I would definitely be, I guess, more interested in just the details. You know, the cost, is a definite big piece. It couldn't be something that takes away from other things. I think that, in looking at it, probably the best way of doing it is just like how you're presenting it, some sort of collaboration with the schools or like some other entities that also like could benefit from the use of the transportation. So looking forward to hearing more about that.
It might be an idea to have this Luz Transportations approach the physician groups, these people that the doctors are sending them to.
The transportation group isn't going to independently contract with those physician groups. We had a brief conversation. They're aware of that. Those contracts are so tiny and idiosyncratic that they can't do that. If we somehow could go to a Graybill, which would be an independent, and said, hey, we're bringing you clients, we would like to be able to get some sort of remuneration for that. I know that Teresa specifically, we had these conversations with those medical groups when we were at the Foundation for Senior Care, and we were able to bring them data that showed how many patients and visits we brought to them, and we got nowhere. The only funds we ever got were grant funding that I got through, I just lost
I don't remember.
health insurance. Right.
Scan.
Through SCAN, thank you.
Scan.
So SCAN, senior insurance, right? We got a $25,000 grant each year, which is what they use for that transportation pot,
They
right?
do offer that transportation benefit to
Right.
their covered
But to
individuals.
do it for every individual, to do the billing for it and to get reimbursed, ridiculous. So SCAN just says, here's a grant,
Here's some money.
here's $25,000 and you're transporting our seniors. So, I mean, there's options, to bill. I would say, I would like to make sure that we have a more consistent partnership to help underwrite that, because grant funding is always up and down. So let's say, the conversation I had briefly just today at an advisory group with Palomar College, when I mentioned, hey, I'm going to bring this to our strategic planning, we have this potential opportunity. If we were to partner to the community, would the Palomar College District, the Fallbrook campus, be willing to help financially give into this? And they gave us oh yeah, count us in. We got to see what the money is, but count us into that part of the conversation. So the fact that they're an immediate yes in a soft manner, but an immediate yes, and that was from their superintendent. And I think the other two schools have already been positive. If we were to, once we get a proposal from this group and we know what the true cost is, I think we could shop it to some of those partners before the board would have to make any kind of big decision. But I wanted to make sure that I wasn't just going rogue and searching this out on my own
No, to be continued.
without the committee at least knowing
Yeah.
in advance.
Well, thank you for the research that you're doing, and this is definitely a topic to be continued. It's going to be a very big challenge.
Yeah, the nice part is we don't have to solve the
Right.
transportation part of it,
Right.
which is conversations we've had in-house of the software and the vans and the drivers, which is part of the reason that the Foundation for Senior Care is saying that they're gonna pull back from this programming, because the cost has just become too burdensome for one small entity
Right,
to be able to handle.
Right.
So,
okay. To be continued.
Alrighty.
Okay.
Yeah, we'll look forward to more information on that. Thank you, Rachel.
sure. So Bill,
Okay,
as
good.
I get that, do you, and obviously I think I probably won't get it until probably closer to the new year, calendar
Yeah.
year. So do you want me to try to leave that at strategic planning first, or to bring that forward to the board? What's your preference?
I mean, we can keep it in strategic planning for now. That would be fine with me. I don't think it's something that we're really needing to act extremely quick on. But
Yeah,
I would be
hopefully-
interested in exploring it for sure. It seems like, you know, if we can get something innovative going, it could be something good for the district for sure.
Yeah. I will tell you that the Foundation for Senior Care did indicate that they might cease their transportation program in January. So
For sure.
they have a time limit, but I did let Perla know that obviously I didn't believe we could move that fast. So I'm just,
Well, I mean,
Just
at the
letting
end of
you
the day, like, we can't just be a continuation of what they're doing. There's a
Nope.
reason why they're not able to be financially feasible, you know, for them to continue. I mean, I'd hate for us to just kind of continue down that bad road, you know. If it was
Yeah.
something that we could do slightly differently, where it made sense economically, and you know, maybe serve more people, it would seem more viable. But I mean, I'd hate to just like, hey, let's just waste the money just because they're saying they're going to go out of business with that on January
Yeah.
1st or whatever. I mean, it's tough for the residents that are using the service, but you know, I think if we kind of do our due diligence, there might be some other options out there for us. So I appreciate
Yeah.
you looking into that.
okay, perfect. So as I get more information, I'll bring it forward, and then you know, obviously you guys will redecide in December who's on what committees and such. But I'll make sure to bring that back to you so that you know, and we can plan accordingly as information comes in.
Awesome. Thank you.
Sure.
Okay. We have B, the urgent care services.
So here we are again, urgent care services. We know that even with Graybill being able to, and I haven't heard that anything has changed, that they're still separating from Palomar and going to stay independent. They're not going to bring urgent care services up here. Judith and I have continued reaching out to different partners. Obviously, the UCSD Tri-City partnership, when that collapsed, UCSD is not going to set up independent shop out here without a partner. We had thought about Sharp, but Sharp, of course, obviously is also connected to Graybill, but they're also connected to Palomar. They're not likely to set up an independent shop out here. Scripps doesn't even look at the Inland Empire. Or, I'm sorry, Inland, North County. So we started looking at our other partner, which is on the Riverside County line, which is UHS, and that is the parent company behind Temecula Valley Hospital, Inland, and Rancho Springs, and then another one in, yeah, it's Southwest Healthcare. It's the parent of
Yeah.
Southwest. So Judith reached out to them, and they were actually quite receptive. So we had a first date where we talked about what we want. They indicated that they have a model of an urgent care, and then they expanded urgent care and primary that they have in Nevada. And they said that's the kind of thing that could work here. They are interested in being in northern San Diego County. So then they came out for our second date, which was a site visit of the idea of just getting the lay of the land. Their main contact, our strategic plan, is a gentleman by the name of Joe. He lives in the Temecula area. He's familiar with Fallbrook. He grew up in San Diego. So we kind of walked them down here, and then taking the data that Judith already got when we did this conversation last time, we went to the area of the 76 and 15, pretty much Riverwalk, that whole development in there. 76 and Mission, I'm sorry. Where you have a ton of traffic. A ton. So we took them down to that center. We were walking around, and happens to be a big open empty suite right next to Bonsall Wine and Spirits, right across from the Daniels / Major Market. Straight visual line from the 76 and Mission. And their eyeballs got really big. And we had a conversation about how they could potentially see this being an area that would fit for their business model. So they are going back to their team to look at real estate numbers, payer mixes, and are going to kind of put together a tentative proposal of what it would take for them to bring that urgent care service. And their urgent care service, we let them know that we're not interested in Monday through Friday, because we already have that with MedPlus. That we're looking at something that can serve the evening hours to some extent, maybe 7, 8 o'clock at night, and at least one day of the weekend. And they just kind of nodded like, of course, that's expected. So I think in their proposal to us, there's an expectation that they would be able to offer those evening hours and at least one weekend day, probably Saturdays, right? So we're waiting for that proposal from them.
Would that proposal look at the site within the Riverview shopping center complex?
Probably.
Or is it an independent site away from that complex?
No, we're looking at within that complex because that's where there's real estate and already a built location.
You might want to check off a box to investigate whether they have a stipulation, because years ago, we tried to put a dialysis unit in there, and they were absolutely adamant about no medical services. They had a couple of doctors that were in there, but anything that was other than that, they were not interested in participating. And I don't know why, because it would be a boon for them.
And I've been given the same information. They've had Temecula cardiology in there for a long time, but this would be different.
Yeah.
That's the ideal location. So we started with that. They have a real estate division that could negotiate at a higher level. Now, I'm with you, Barbara. I know.
I just don't want you to spin your wheels.
No, the idea is the proposal would be more for the services and less for that specific spot. Well,
Yeah.
that's the ideal. If that didn't work, we could go down to the other corner where the Arco and everything is down in there.
You know, maybe they would want to consider having like a mobile unit that they
Wait,
can do for urgent care, like you have a blood bank, and just have it rotate.
The problem is that then people can't find it.
Well, oh yeah, you're right. You would have to put it posted where it's gonna be.
Right, and when you're looking for urgent care, you're not gonna try to find where it is today, so. Plus, it's a large infrastructure expense to set up and
I wonder if they'd be interested in the one that's already at the corner of Mission and,
no, because there's not enough traffic there.
oh.
That's the point, it has to be the traffic, so,
Right, it has to be the traffic, it has to be the volume of patients. They started, they picked their urgent care business back up in 2021. So they've kind of rebuilt a model and they picked it back up from Southwest. So there are certain parameters they're following that
Right.
obviously we're
Yeah.
not privy to.
Yeah,
So,
we got that
but
before.
the mobile
Mhm.
unit is not something that they had back up for discussion. So it's like what we're saying, you know, they're looking at that as the ideal location. We always start with the ideal. We don't know that we can get it, of course, but
Mhm.
I think just kind of basing it off that to kind of give us rough estimates of what we're looking at right now
Mhm.
to see what they can bring to the table, what they can offer, what we can bring to the table, what may work for both entities.
right,
Is kind of like where we're both at.
So what happens when a retirement community is overwhelmed with growth and the population?
right. Well,
Mhm.
and Judith brought forward today, some information, the 2023 Urgent Care Association. And I've been trying to get it digested, which I thought this was brilliant. So, what they've really looked at is the title of their white paper is The Essential Nature of Urgent Care in the Healthcare Ecosystem Post COVID-19.
Okay.
And I think it's the post COVID-19 that's most relevant, because when you look at that from data from 2019 on, it does not match post-COVID data because we changed how we do healthcare.
Right, absolutely.
So looking at this, and one of the things that we saw before that you're really seeing in this is that the people who use urgent care are not seniors. The people who use urgent care are millennials and Gen Zs, folks who do not generally have a primary care physician
Mhm.
or have less faith in primary care and traditional methods and
And they're not
vehicles.
covered by insurance.
No, they are covered by
Oh, they are.
insurance, but they don't go to their regular physician because they're not willing to wait 3 weeks for an appointment. They
also don't have loyalty to the.
they also don't have loyalty to the doctor. It's not about the doctor anymore. It's about,
school? Okay.
they're like, I just need to go to urgent care because I have a staph infection or I have a UTI or my kid has a whatever.
Mhm.
And so they're seeing urgent care, and they were also talking about like at CVS, the minute clinics, these retail clinics that have nurse practitioners for minor ailments, which is what a younger person generally will present with. Older folks, and they put us Gen X's in there, us Gen X's and boomers and silence, apparently, we are still willing to go to our primaries because we're more likely to have more complicated health issues that we're not gonna go to an urgent care for on average. So that's where it seems medicine is going. There's a lot of great information on the rise of urgent cares. So when we start looking at proposals for urgent cares again, I think the district has already learned the lesson that the one-man show urgent care will not work. So the Dr. Skio versions, the Dr. Cohen versions, they don't have the bandwidth to operate what we need, which is why they're not thriving here. So that's part of the reason we went to a larger entity like UHS. So again, we're waiting for another proposal to see what that looks like. We know that the location is going to be important and we're going to need to be along that 76 corridor. Again, that's a larger entity that already has a whole division for real estate that can negotiate bigger and better than we could independently.
Understood.
Right, and as a large entity, they can take a variety of insurances and deal with that whole thing.
So that's where we're standing with urgent care.
It's not the first time we've been here.
Nope.
I know. The other thing is, a lot of these people just need to adhere to the parameters of their health plan. But most of them are so independent, they want what they want and they want it now, which is why the urgent care is really necessary and important. And they do have them along the freeways and they're serious about having easy access, because if you have an issue, you want to go and get it dealt with as quickly as possible.
Right.
And if you go to the ER, I can tell you, you're not going to get triaged within the first 15 minutes if they're busy or backed up. Even
Right.
Loma Linda, as wonderful as it is, it's a nightmare.
Oh, yeah. And I mean, I think we got results from Keith and Brian from North County Fire when they came and presented and were talking about the turnaround times from those hospitals being so long because they're so backed up. It, you know, the conversation we had inside here was my husband cut his thumb pretty significantly. And he's like, we're going to emergency room. And I said, the hell we are, we're going to urgent care because I'm not gonna wait 6 hours minimum
With your thumb on ice.
with your, yeah. And it wasn't like it was cut off, you could still move it. I'm like, you're fine.
Yeah.
It was too much for a bandage at our house, but,
Just hold it up.
just hold it up, right? Let me get some super glue. I'm not a doctor, but I play with that beauty. Instead, we went to the Temecula 24-hour urgent care and we were in and out in about 2 hours, which is pretty good.
Yeah.
Stitched it up, follow-up care, everything was fine. I think that's what we could hope for here. So we'll wait for that proposal as well.
Or you might see Graybill do a turn and decide that they want to get into that kind of a business.
You know, it's worth letting them know that we're investigating. I know that when the district did the very first RFP for urgent care services after the hospital closed, Graybill declined to submit.
I don't think it was the doctors, it was the management.
Well, they weren't part of Arch and all that.
But Graybill itself was still affiliated with Palomar at that time.
No, they weren't part of that. They weren't part of that umbrella yet. They were close.
They were using the Palomar, this is when Palomar Hospital was in Escondido. They had subcontracted with all of the ancillary services that Palomar Hospital had for their employees to create their own self-service medical complex. They were self-insured. So they had a network of providers and doctors that they used for all the employees. When Graybill got started, they picked the best of the doctors in that area and they got into a group and they were providing services to Palomar Colorado Health Systems employees. And then BJ Munderloh, their administrator, got the brilliant idea to go out there and contract with the identical providers that the hospital had for the employees and create a contract arrangement that was entirely separate, specifically for Graybill. And that's how Graybill got the legs underneath them.
Okay, so it would be worth our time to at least let Graybill know that we're looking for something and see if they would be willing to at least mock something up for us.
These doctors want to practice medicine, they really do, and they're used to the managed care idea, which is why they're going crazy now, because now it's going back to a lot of manual and oversight. And but they were very passionate about this community. Bridgman, Dr. Winton, Dr. Martinez, there were so many others that were just fabulous.
With the two offices in Vista and Oceanside already staying independent, it might be that group could be large enough, but we can reach out to them and see if they can put together a proposal, if they have even an interest.
So they have an interest.
Yeah, if they express an interest, we can ask, but everybody else we've chatted, that one wouldn't even talk with Palomar, so
Well, we can have a little competition.
It wouldn't hurt, especially if I think we have to make known the premise that whatever we're doing for urgent care, we're looking at the southern side of our district. Because that doesn't have any services down there, and that's where the population boom is.
Yeah.
So all of the research
You're
says
referring
that's
to
where we have to
Bonsall?
look. The whole Bonsall 76
Yeah.
zone down there.
Oh, yeah.
Yeah.
Definitely.
So that's where we stand with that one.
Well, again, thank you for doing the research on that. I know it's tough, and for the staff to kind of keep going back to the same well, kind of hoping that like maybe some of the answers will change. But I think we'll get there eventually. I think if we kind of just keep progressing that way and looking, and checking our opportunities, it'll eventually happen. I hope.
Yeah.
So, but
Yeah.
thank you for that, and we'll go ahead and move on to the last item here. Just status of community health contracts program.
Yep, so in trying to think forward on a 3 to 5 year timeline, again, we talked about knowing that our community health contracts, aka our grants, would be less than they used to be, right? We've already started that decline back to a funding level that we were pre-wellness center. With programming ramping up at the wellness center, financially, we're able to sustain those as they are. But as we think about a transportation or as we think about urgent care, we're going to have to start looking at where our operational dollars come from. And we're not going to be able to sustain the level of community health contract grants if these other two strategic initiatives are going to be our priorities. So this is the committee that's responsible for knowing what this program looks like. So I wanted to make sure that we're having the discussion that says we're likely going to have to consider decreasing the amount of money available for the community health contracts, potentially in this next upcoming fiscal year, depending on what these other two initiatives come forward with expenses, right?
Growing pains.
It's growing pains, right? The district has told the grantees for no less than 10 years that the amount of money they were giving away would decrease.
Yeah, it was like startup money initially,
Right.
like seed money, and then
Right.
you had to generate other opportunities to get that income and support.
Right. I know that when I came to the district, when I came into Fallbrook in 2015 to work for the Foundation for Senior Care, I heard from Bobby straight out, we're doing these grants, but you can't be used to them because the money will decrease as the wellness center comes on. Okay, well, obviously there was lots of fits and starts and the money was a lot up until about 2019. When I came over here, the board already had the agreement, we were gonna start decreasing it because now we were gonna bring up
Right.
wellness. Can't really count 2020 because COVID, we gave extra funds because it was important
Right.
and relevant.
Right.
We really started programming in earnest in 22. And we started decreasing the amount of grants, holding true to what we had said to the grantees back in the day. As wellness center operations came up and became more expensive and offered more services, there'd be fewer grant dollars. We started that last year. We continued it in this year. And I think we're gonna probably have to do it maybe even a little bit more significantly for next year, knowing that we're trying to get these other two services or more up and coming. So I wanted to make sure that this conversation happened now because traditionally I start the grant applications as far as the format now. And then in January, I do the grant training for the grantees and the grant application window opens in February. So it's important, I think, for the board, we'll probably do a new board level strategic planning workshop in January because we'll have new board members. And I think it's important that this committee considers whether or not to make the recommendation, hey, we're going to cut the amount of grant dollars by 20, 30, 40, 50%, whatever that looks like. Hopefully we'll have enough information from these other two proposals to have an idea of what that money would dwindle to. So that's what I'm bringing forward with this line item on the agenda.
Yeah. For me, like I would want something a little bit more kind of concrete before I was comfortable like cutting any sort of funding. I mean, I think that the practicality of the situation is that we're probably not going to fund some of the grants for Foundation for Senior Care if they're actively like hemorrhaging money and closing programs and whatnot. So there might be some leeway to kind of shift some of that over to like a transportation program or something like that. I would be good with doing that. I mean, I think that both of those are strategic objectives that we have, but I'm not sure if we necessarily need to cut the budget by 50% or anything significant in order to account for, just the possibility that we run into those things. I mean, unless we got some sort of more significant like proposal that kind of made sense, like, oh wow, that's exactly what we're looking for, then I could imagine that would be a good reason to do that. I mean, and I think that like what you said is spot on, like that we've decreased it because we've increased services. We've done more stuff like funding the ambulance. That wasn't something that was going on like when a lot of the grants were first started. So I mean, there's a lot of different things that we're doing here in the community. So it makes sense for that number to go down. But I would kind of prefer to have something like, a little bit more concrete in hand before we were like discuss cutting major portions of that. I mean, I think that a lot of the grant funds, they fund a lot of amazing programs in town, and I get it. It's going to be tough when we start to say, hey, it's going to cut by 50% or 40% or something significantly like that. But I'd at least like to have like something in mind, like, hey, this is what we're spending the money on. It's going to be a whatever urgent care, or it's a brand new transportation program, or so and I also, like I said, I would be a lot more comfortable with like any sort of transportation proposals if it came with, some sort of partnership with other agencies that are going to kind of help us with that. So I'm not sure how quick your timeline is. I mean, it seems like a lot of work to get done before the grant cycle and everything. So
yeah, but
that would be my thoughts.
And I agree, Bill. I'm not saying that we have to make a hard decision. I just want to make sure that the conversation is had.
Absolutely.
So that, if we get the golden proposal for transportation in December and we get a golden proposal for urgent care in March, we might want to make sure that we have the ability to accept or be flexible on them. We have enough funds in the investments that if we needed to, if the board chose to go ahead and take advantage of it, we could do it outside of budget cycle. But I'm just thinking from the long-term strategic that the messaging back to the grantees is, don't forget, we are still looking at these other initiatives. Don't expect grant funding to go up again. It's going to stay at this lower and or potentially could go lower. And I'm not looking for the board to make we're going to cut it by 70% this year.
We discussed this in the past, in the minutes somewhere in the past, it'll reflect that we said that we didn't want to see duplication of services. And that was one of the considerations for the grant.
Right.
So if the wellness center is providing a service that we're providing grant money to on the outside, I mean,
we don't really have any duplication of services. There have been a few areas where there's some potential overlap, and we've already started trimming that out.
Right. And there's another area that we really need to consider, and that the whole community is going to be dealing with, and the fact that I don't know if there is one particular medical group that has a gerontologist. Our senior population is getting larger, and we have diminished access to doctors. And aging is not a disease, it's a process. And so many people don't understand the cycle that the aging does to the body. And if they just had the basic understanding, I mean, it would help them understand that a hot bath, couple of aspirin, maybe eating less spicy foods, a little more exercise might help them in their well-being, because they can't expect to eat like a 16-year-old anymore. A little more body mechanics education, so they're not going 90 miles an hour without looking out for the safety issues that are around them. Getting the rugs out of the house that they can trip over, and the animals that sleep in bed with them that, kind of get in the way when they're getting up in the middle of the night trying to get to the bathroom.
Yeah.
These are just intelligent dynamics that they need to be made aware of, because you get in your own pattern of behavior, and at that age, you think you know everything. You got it, no problem. I got this. Next thing you know, you're falling down the stairs and you're flat on your back in the kitchen and you're going, what the heck happened?
Yeah.
And our doctors from Graybill could really mine that particular area and partner with Foundation for Senior Care and create something really dynamic.
Again, we're not in control of that, but
Right.
you've got a good point, and the reason I'm piggybacking on that is several of the programs we've had at the Wellness Center were safe driving for seniors. We've had a number of senior-related educational services. The most recent one that's coming up is the medications.
Yeah.
Knowing your medications, where they're overlapping,
And if you can take them all together, which a lot of people do, they have a cup of coffee, a handful of pills, and they don't know why they've got this weird behavior until about noon.
You're taking your uppers, you're taking your downers, you're taking them with your
And then
caffeine,
when you're vibing.
Combine and check your mood.
right?
Exactly. Really, it is so important to be able to give them the ability to have healthy cognitive behavior,
Right.
if they know where the pitfalls are in the aging process.
Right, and that education doesn't have to cost a ton, and that's where Teresa's done a great job really reaching out to county and other partners
Right.
to bring those services in.
Right.
And that'll impact, again, to Bill's point, whether it's the Foundation for Senior Care or what. I know that the Foundation for Senior Care and the Senior Center,
They're two different things.
they used to be. They are now finally talking
Good.
about how they could better integrate services.
Excellent
It
idea.
took forever,
Yes.
some board changes,
Right.
but they are finally looking where they could potentially be a stronger entity together. I'm not saying I know that they're merging or anything of that sort,
Right.
but I know that they're communicating better now. And I think we may see some, not necessarily consolidation, but maybe more collaborations
Yes.
among some of our similar mission
Excellent.
nonprofits.
Foundation for Senior Care was created as a case management oversight.
Yeah.
So that these patients that were, who were discharged from the hospital weren't bouncing back into the emergency room,
Right.
because the doctors weren't giving them follow-up support once they discharged
Right.
them.
They
And-
started, the whole reason Bob Wright and the whole crowd
That's right.
took it over was so that they could have that advocacy level of services. And then they added on the
Right, 'cause
daycare
it
and
was
they
killing
added
the
on.
hospital when these patients were
Right.
discharged, and they found out there's nobody there at home.
Right.
They needed meals, they needed their medications.
Right.
They went home and they're still befuddled from their hospital stay. And so
Right.
this was to help to ensure them to be on the right track and have some oversight, so they wouldn't hit the ER or go back in the hospital.
And here we were 35 years later and
At
the
least 23.
23,
But
and you're
it was
seeing,
going on before that.
oh, for sure.
Because I came here in 93.
You're seeing this program that Grossmont is doing with the county for this rural discharge program. It's the same concept that used to be where the hospital had a social worker that did that. They eliminated that. They had all this problem. Now they're bringing back a similar kind of service that Grossmont is funding with the county. Now, the county can't necessarily sustain this. We'll see what happens with that programming. But that's the kind of service that I think if we were going to provide district direct care funds in the manner of an MOU, which we're already moved some of our folks over to, that's a good place for some of these discretionary dollars where there's an option. It would pull money from the grants, but it's still from that pool that is direct care services to our community. So, to Bill, let me circle back. To your point, I agree, we're not ready to make a specific dollar percentage cut to the grants, without these other proposals in line. But I do want to make sure that we're continuing the conversation to our grantees of the amount of money available for grants is going to not get bigger.
Right.
And you can expect that it will get smaller as we bring more of these services to the district.
Right, they need to find other backup as well.
So I want to make sure that we're clear on that conversation to the grantees. So maybe, Bill, that's what I was trying to. Oh,
We lost him.
okay. Well,
Maybe
I'm on the
we'll come
record.
back on. Yes, you're on the record.
Okay,
So,
well,
but does that make sense, Barbara, to you?
I would say to be continued.
Yes.
The thought is now out there and on the record that the education of our grant recipients is going to include emphasis on future funding, not being as generous as it has been in the past due to the growth of the district and the programs and the wellness center.
Yes, well said, thank you. So, and because we're gonna do more education, we're still good?
We're good. He's just not back yet.
Okay, so we'll start that education with them this year for
Mhm.
sure.
Yeah.
Whether or not that gets fast tracked will really depend on whether or not these other initiatives provide proposals to us. If transportation and urgent care services come forward and they have price tags that partners alone can't cover, the district is interested in picking up some of it. The only pool of money we can do that from is the grant funds.
Right.
So it's just gonna have to be an ongoing conversation, but I think if we talk about it openly now, we're better served than talking about it at the same time we're trying to cut grants or something.
I would agree.
Okay, well, that was all I.
Shall we wait for Bill to come back and proceed?
We're waiting to see if he can pop back on. Cause the only other items really was comments and future agenda items. And I would say for future agenda items, I would roll all three of these to the next meeting.
I'd say you would be accurate in doing that.
Okay, I don't know that we want to add too many more projects.
No, if we just want to get feedback again on the gray bill.
Yes,
Because I know that Dr. Winton was a board member and he was dedicated.
Yes.
He was involved and he hated the circumstances that were going on during the time of his tenure with us. And he was very disappointed that we couldn't get further along because of circumstances beyond our control.
right.
But he was 100% in, and I would love to see him and the other doctors really think about what they want to do here in Fallbrook and maybe partner or think about other options that might be presented to them. And I
Yeah.
understand he's an individual and he paid his dues and he knows the community and he's a gem. He's a marvelous doctor. He really is. If you go to him and you say, something's wrong, he'll have you diagnosed within a half an hour.
The part that would be excellent for that is if he was there 5-6 days a week, but he's
Right.
not.
Right, well, he's
And
holding
that's-
another position
Exactly.
in Bakersfield.
And that's the only, well, it's not the only challenge, but that's one of the biggest challenges with that particular business is that
He could
we don't
grow.
have a consistency.
He could grow.
He could if he was there.
But I mean, if he had the conversation with those particular doctors that express an interest, there might be a relationship that could bloom and benefit, the
And
whole
maybe-
community.
And maybe now that Graybill's not part of Palomar,
Mhm.
maybe that conversation could be reignited.
Yeah,
So, I mean, I'm willing to make sure he's aware of that.
Yeah.
Cause he doesn't live in town, so he may not know
yeah.
what's happening. I talk to him probably once a month, maybe in small ways, usually via text or email. But I'm sure that he'd be receptive to a phone call, but I'll talk with Graybill first just to see what their interest is.
Maybe they can make an arrangement with him and rent the facility out when he's not there.
You never know.
You never.
I mean, that could expand services there, which
Would be wonderful.
would not hurt
Yes.
at all. So, no, still no bill?
No,
All right, well, Barbara, did you have anything else that you wanna add for future agenda items or other comments?
Not on the record. I think we can, these are just side comments and observations that I've been made aware of, and I think that, we have our agenda full as it is. There's a lot to be considered with what's going on in the construction, the development, the presentations that are going to come up. You know, that you're going to be facilitating, more information to the board to make
Yeah.
decisions. I think we've got our hands full, and then November, you've got, Thanksgiving holiday.
Yeah, I mean, the end of the year is already, it's
It
already
feels that-
tight and full.
Yes, yes.
And then obviously board changeover in December,
Right,
so that'll be tough
And
because
what-
we'll have onboarding new people.
right. Well, I'll be around the corner if you need me,
I know, and we
Until-
appreciate that.
until I can find out what direction
The rest of your.
the clown show's going.
Yeah,
You're still on the record.
you're still on the record.
Please.
So, Barbara, would you like to adjourn the meeting for us?
I say at this point in time, that would be a great idea. If there's no
Great.
further comment, the meeting has been adjourned at
6:50.
6.
6:56.
6:56 it is.
Perfect.
Okay.